Did you know that something as common as a callus could lead to a serious wound? That something as simple as a buildup of skin could be hiding a bigger issue? Today, we're going to talk about calluses, why they form, and more importantly, how they cause wounds and impact healing if left unchecked. Calluses may seem harmless, but they could be the body's early warning sign for a more serious underlying condition, especially if you have health conditions like diabetes or circulation problems. So, what is your body really trying to tell you with these thickened patches of skin? So, as we know, calluses are thick, hardened layers of skin that develop from repeated friction or applied pressure or any other forms of repeated irritation at the site. I'm sure we've seen them before on our hands or our feet, which generally tend to be the most common locations for them. And our body produces calluses to protect the underlying skin from damage. But here's the catch, especially for people with diabetes or poor circulation. Calluses can be a red flag. Beneath that thick skin, dangerous pressure ulcers or even infections can develop without even you noticing. So a small callus isn't usually a problem for people with normal sensation in their feet. However, people who have neuropathy, that's when the sensation is decreased or abnormal in some way. Calluses can go unnoticed for an abnormal period of time. And if the callus is left untreated for too long, it can lead to damage to the soft tissue underneath. This can lead to inflammation, bleeding, and even tissue death, eventually showing up as a wound or ulcer when the callus is removed. It's sort of like having a built-in rock in your shoe. So people with diabetes, for example, can have calluses that mask underlying tissue damage that, if not addressed quickly enough, can lead to diabetic ulcers, which can be harder to treat and heal. So when should you worry about a callus? Well, if you notice any pain, changes in color at the site, or changes in texture at the site of the callus, it's time to take action. If left unchecked, calluses can break down, leading to open wounds, infections, or even more serious complications. The good news is that with proper care, you can manage calluses and reduce the risk of complications. Some tips are using a pumice or a gentle file to remove the dead skin after soaking the area with some warm water. You can also consider investing in well-fitting, supportive shoe wear that minimizes that friction and pressure. Some medical professionals may even recommend custom orthotics, depending on your situation. And most importantly, if you have any underlying health conditions like diabetes, you should be getting your feet checked regularly anyways by your healthcare provider, not only to check the calluses for any underlying injuries, but any other injuries in the area. Unfortunately, sometimes home care isn't enough. If you see any signs of inflammation, any increased pain at the site, or any signs of an infection, you should seek medical attention immediately. There are different treatments like debridement, where a medical professional removes excess skin to prevent the callus from developing a more serious wound. So the next time you notice a callus, think twice. It could be more than just hardened skin. For people who are at higher risk, by managing calluses, you can stay ahead of potential complications and reduce the risk of potential wounds. Take care of your skin, and if in doubt, seek professional advice. Thanks for watching. If you found this video helpful, don't forget to hit like and subscribe for more wound care tips. Also, if you have any general questions about calluses or wound care, drop them in the comments below and I'll be sure to answer them. Stay informed and heal well.